So the masturbation is not to be condemned as immoral or sinful or harmful. Neither it leads to weakness nor bodily harm unless and until it is abnormal or excessive. So what is important? Avoid feeling of guilt associated with such acts. And of course, we have to discourage if it is open, excessive or abnormal way, which can result into harm to the body. The next issue is about homosexuality during the adolescent age. It is a physical romantic attraction between the same sex. If transient, it may not be significant again. Physical attraction is almost unnatural between the same sex. If persistent, it needs counseling and intervention. Avoid scolding, threatening, or guilt-inducing behavior in adolescent. Make the child feel safe and less guilty. Maintain the confidentiality. Try to explain him that this is not a natural or normal behavior, but at the same time, as it was labeled as a criminal act or it was unlawful, few years back, the Supreme Court has decriminalized the homosexuality. Another sexual aberration can be live-in relationship, but in the present era of modernization, where the life is busy and the false sense of autonomy, as we discussed, the stage of turmoil, all this has resulted in increasing incidence of live-in relationship. The drawbacks are emotional disturbances again, familial disturbances, many times there is lukachipi, and the legal status of children we do not know. It increases the incidence of HIV and AIDS. But again, few years back, Supreme Court has legalized the live-in relationship to some extent. Another important issue is about virginity. The modern society, it is taken as a personal choice. But in the traditional society, the preservation of virginity is still a major issue because the concept of purity is attached to it. So, if there is improper loss of virginity, it can result into cultural, emotional problems because, as we said, still there are many things which are not accepted in our. The issue of tradition, self-discipline, and self-dignity comes in, and the various emotional problems, and again there may be feeling of guilt. So all these things are to be taken care of. Very important legal issue again related to adolescent sexuality is pornography. As we have discussed, there is curiosity, fascination, and urge about the sexual feelings and behavior. So this results into many times pornographic activities. Interest in nudity, erotic picture are part of the normal sexual maturity or curiosity. One of the important cause for pornography is bombarding and invasion by the media, and as we discussed, unscientific yellow magazines or so-called dirty books. All these media and magazines do not deal in truth because their aim is not to educate but to sell. Many times they distort the image of the woman as a sex toy, reduces gradually as the sexual development further matures or the sexual development is continuously occurring and the development child becomes and understands the importance of all these things. So what is abnormal again is obsession with the pornography is abnormal, and there should be effective legal actions against the pornography or use of child in pornography. So that is sexual abuse because of the cultural invasion, media onslaught, blind race with the Western countries, Incidence in our country is also increasing. There is increased incidence of molestation, fondling, petting, incest, rape, etc. One of the important things which we have to remember is the sex abuse. And please remember in the sex abuse that both boys and girls can be abused sexually. And because of all these things, the government has come out with with an enacted law, that is POCSO Act 2012. We'll not go into the details of the POCSO Act, but this one slide is how the POCSO Act deals with. It deals with penetrative sexual assault and sexual harassment, which includes pornography. Punishment is prescribed for all these acts. There is aggravated form when it is done by someone who is in place of some authority. And if it is done by more than one person, then it is labeled as a gang sexual assault or gang sexual harassment. Effect of sexual abuse: the mind is again disturbed, behavior is there, depressed, unhappy and anxious mood, decreased self-esteem, suicidal attempts, various sexually transmitted diseases, including the HIV infection, and adolescent pregnancy. Adolescent pregnancy is important issue which will be discussed probably in the gynae. We will not discuss here in detail, but that is one of the major issue in adolescent. The other sexual problems which can be there are related to the behavioral problems, that is nocturnal emissions, masturbations, sex play, dating, petting, etc. The medical problems related with the sexual abuse or with the sexual development is dysmenorrhea, pelvic inflammatory diseases, sexually transmitted diseases, teenager pregnancy, which also results in unsafe abortion and many health issues, which are all covered under MTP Act. Juvenile delinquency, we always find or we see that there are many problems, especially in the Western country. There is killing of the associates, killing of peer, the problems created by the student for the teachers in the schools. So various offenses, crimes and law breaking by the adolescent child. It's again very important. Nature as well as nurture, type of upbringing is important. Too much or too little discipline, disorganized family, cruel parents, all these predispose to juvenile delinquency. Please remember, boys as well as girls can be the victims of juvenile delinquency. What is required is change in environment, various predisposing factors. Involve the child in more of constructive activities, and sometimes it may need psychotherapy. So last two slides, if there are some technical problems and if there are some problems with the Zoom, we'll stop here. The two slides are remaining, otherwise we'll complete. And tomorrow we'll take the nutrition lectures. So from tomorrow, though it is Sunday, we'll have 10:30 to 11:30 lecture. So during all this adolescent development, what parents should not do? Do not criticize unnecessarily, do not interfere unnecessarily in the activities of the adolescent. At the same time, do not leave them undisciplined. Do not compare with the others. As we said, all children are different. Similarly, all adolescents are different. Do not use dual standards. Do not force career choice, and do not do spying. And as we discussed repeatedly, the parent should be a good role model for the developing adolescent. And what adolescents should do and should not do, this is the last slide for today. The adolescent should be alert and sensitive to the changes occurring in the family and in the environment. They should not get upset by the criticism or failure in the life. treat the opposite sex with dignity and respect. If there is a leisure time, the activities must be planned. So now with Corona pandemic, everybody is locked down, so you have to plan your activities. Excessive emotion should be avoided, whether it is in the friendship or with the parents. Have self-confidence and realistic approach. Be critical, analytical, and have positive thinking. Self-esteem should be maintained. Say no to unhealthy pressure, whether it is about sexual relationship or substance abuse. If you have any problems, communicate with the parents, peers, and teachers. Experimentation with drugs and sex should be avoided. With all this carry home message from today's lecture, we stop here, and tomorrow we will take the nutrition chapter. If you have any queries, please put in the chat box so that we can discuss for today's. So if you have any queries, you can ask or you can put it in the chat box. See, double standard means we say something and we follow something, or we have two standards for two different children or two different adolescents. Double standard means we say that do not do this, and at the same time we are doing this. We are asking girls not to do this. For boys, we are saying, okay, you can do it. So this is probably double standard. So we should not follow this. One thing for one child or for one adolescent, and something different or something opposite of the same is for the other. Okay, so if you do not have any further queries, if they are there, you can ask tomorrow also. We will stop here, and tomorrow we will discuss the nutrition part. Yes, the legal punishment will be there, but usually this punishment are soft, and as you are already written remand home, so most of the time the child is put into remand home till he is not sent to the like a criminals to the jail or something like that. There are different courts where all the possible measures for the confidentiality is kept. So usually the juvenile delinquents are not treated publicly as the other criminals are treated. So legal punishment is there, but usually they will be put into the remand homes or some better place as compared to the criminals. Homosexuality, as we said, it is a natural, because during development, when there is a rebellious attitude from the parents, the adolescent has peer relationships. So he has friendship, and this friendship can be with the same sex or with the opposite sex. And in any friendship, there can be sexual relations. So if the friendship is with the same sex and it is sexual activity is there, then it can be homosexuality. So to that extent, it is natural, but after that, after a particular age, it becomes unnatural. In previous, our society, it was considered as unlawful also, but as we discussed about 2 or 3 years back, the Supreme Court has made Section 377 not a criminal offense. So homosexuality, though it can be taken as unnatural, it is not a criminal offense or not unlawful. Causes of homosexuality cannot be congenital. It is basically, as we said, developmental. So the homosexuality is only nearness to the friend or to the colleague, and it's not only nearness, it becomes a physical nearness, then it becomes homosexuality. In adolescent history, all these things you have to keep in mind, and with the POXO Act 2012, now it is important to report any sexual abuse. If somebody of you have seen, about 2 or 3 months back, we had a patient in our own hospital, PDMC. There was a girl with vague complaints, about 14 or 15-year-old girl, and then when she was examined by the obstetrician, we found that there are some genital ulcers and some infection, genital infection. Then history of sexual abuse was taken in that adolescent, and there was a history that she was abused by one of her maternal uncle. So this has to be reported to the police, because otherwise, if you do not report, you are responsible for the action. You will be held, taken responsible, and action will be taken by police against the doctor. So it is very important to ask the history of sexual abuse. Another, we had 2 or 3 patients in our PTMC last 4 or 5 months, where they came as a case of anemia. And when they were not responding, there was anemia, there was polymenorrhea. And when we sent for obstetric consultation, they were found to be pregnant. So teenage pregnancy resulting into excessive blood loss because of the abortion. And then they were treated for the pregnancy, and the cause of anemia was excessive bleeding because of the abortion. So all these things are very important. Last menstrual history is very important, because if you want to give some drug, and as we said many times, the child can be pregnant, so there can be effect on this child. So giving drugs to the adolescent girls, you have to take the history of LMP. So LMP is very important in adolescent child history, because many times we can diagnose teenage pregnancy, we can diagnose or we can prevent exposure to the drugs. Vaccination importance is same as we have the importance in the child. If you give vaccination to adolescent, which are required in the adolescent age, they will be protected from those diseases. And if you do not give a vaccine to the adolescent, they may remain uh, exposed to those diseases. Most important are chickenpox, typhoid, and of course, as we know, the rubella. If there is rubella in the children in the childbearing age during pregnancy, the incidence of congenital rubella will increase. So vaccination, especially like typhoid, chickenpox, rubella, MMR, because if child develops mumps during the adolescent period also, if is not immunized for mumps, it can result into infertility. It can result into pancreatitis and diabetes problems. So vaccination is important in any age, not only children and adolescents, but those vaccines like tetanus, which are required for even for adults. So all these vaccines should be given to adolescents. See, the external behavior will be almost same as we said. The concealed emotions as well as the overt emotion. So similarly, if the thinking is positive, usually the child will not have a abnormal behavior or the wrong behavior. So external behavior, if he has a positive thinking, he will always do good things. But if there is a negative thinking, he will lead to rebellious attitude and as we discussed in stage of turmoil, he will have a loud and aggressive behavior. But a positive thinking person may have a proper behavior and he may not show the things that is, it may be even wrong for his feeling. But he has a positive thinking. So if he thinks positively, if a person has failed, he has a positive thinking. What he will do, he will study more. Next time he will try to pass the examination. But if there is a negative thinking, the child will have more of inferiority complex. So he will be showing the behavior like he is going to ask everybody, please give me your notes. You have passed last time, now give me your notes. I cannot make my own notes. So like this, there will be changes in the behavior, external as well as internal. So you have to keep in mind you have to monitor the behavior. It may be positive as the positive thinking is there, or the behavior may be negative as the negative thinking is there. So we have to monitor, we have to understand, as we discussed in the last lecture on development, children's many time or the adolescent or any people do what they think as they have learned through their environment or through their teachers or through the parents. So if some mistakes are made, basically we have to understand that why they are behaving like this, what they have learned from our society, and how the behavior, if it is wrong, how we can improve that rather than giving punishment. So every time punishment is not the thing that has to be given or thought for the child or the adolescent. So many times we have to have the behavior modification techniques. Like some time back there was a concept of open air jail. So don't put the individual, those who are criminals, in a behind the bars, but keep them in a open air jail. So like this, we have to think of the behavior of the child and adolescent. We have to think how he is behaving, and at the same time, our behavior should be good, as we discussed in the rules for the parents, that they should be a good role model. So the society has to become good role model rather than we accept each and every individual to behave. Like we see, or many times when there is a incidence of rape, many times the public are saying that the mother should teach the sons how to behave with the opposite sex. But at the same time, the media is full of sexual activities or sexual pictures or sexual messages. So that should not be there. We should not, this is also double standard. Somebody has asked about the double standard. So what is double standard? We say something, we want to change someone, but we don't follow the same thing in our practice. So media is showing the wrong things. We are continuously seeing that media. We are seeing the negative things in the media, advertisement of junk food, the sexual assaults on the girls in the pictures, in the serials, and then we say this should be stopped. So this is double standard. Please do not follow the double standard. Okay, so with this we stop here. My computer is showing only 3 minutes of session left. So we'll stop here. If you have any queries, we can discuss tomorrow. This is very important topic, and tomorrow's topic is equally important, that is nutrition. So we'll meet tomorrow again at 10:30.